Say and spell your name so I can have it right. I know how to spell it.
Devon Picou, Devon Picou.
Okay. What do you do for a living?
I'm a server, a waiter at Chili's.
So, do you have health insurance?
No, I don't. Not currently.
Do you get to see a doctor regularly or anything?
No, I don't go to the doctor unless I'm probably very ill, and I'm lucky enough that that doesn't happen too often. I had health insurance for a while, but the cost of it didn't justify. I never went to the doctor to get regular checkups, or I wasn't ill often enough for me to pay what it was costing me to just stay insured.
So, is that a common situation with people you work with?
I think so, very much.
Yeah.
I don't. I think a lot of people that I work with stay under their parents' insurance for as long as they possibly can, and then once they can't anymore, they just go uninsured, basically.
So how long has it been since you've had health insurance?
Probably a good couple of years, 2-3 years.
So, so you haven't had any major incidents that you had to, like, what happens if you get a cold? What happens if you get a sinus infection?
I don't consider that being sick,
Okay.
because that's not something, like, unless I have to go to the doctor, I don't consider that being sick. I just kind of deal with it. That's just one of those things that I just have to power through that week, I guess.
Yeah. All right. Now, your dad died about 2 years ago.
Yeah.
Right. Now, and that he basically had a chronic disease that really, as we both know, it took his life in about 4 or 5 years. We just saw him go down from a pretty healthy guy to.
He lost a lot of weight. He really declined a lot. Yeah.
So he didn't have health insurance.
No.
And it took him a while to even convince him to go to a doctor.
I think he was scared. He was scared of not having health insurance, not having a way to pay for it.
Right.
Not knowing what to do even. And I think that maybe the doctors that he went to probably didn't know what to do with him either. Maybe, and that was probably a combination of the fact that he didn't have health insurance and didn't have the means to pay for the proper treatment.
So I remember he went to a community health center in Abbeville and got referred into the University Medical Center.
Mm-hmm.
But there was always long.
Nobody likes going to the University Medical Center. I've never heard of anybody not waiting an entire day just to see somebody.
There was weeks and months between the times he would, the appointment would be scheduled.
Because schedules would get pushed back all the time. He would go for a checkup and they'd say, okay, well, we're going to look into this and we'll set up another appointment 3 months down the road. Mm-hmm. And what do you do for those 3 months?
Right.
You just sit and wait and get worse.
Apparently, huh?
Yeah.
Yeah. So, this is a common situation down here. We have we have high incidence of chronic disease. We have higher rates of mortality from chronic diseases than people in other states because people don't get access to care when they need it. If you have a chronic disease, it means it's manageable. By definition, it's manageable if you can get the care.
Yeah.
And have you seen other adults in sort of similar situations, circumstances?
Yeah. I think that there are plenty of people who don't have health insurance or don't have the opportunity to take care of themselves medically because of financial reasons. None so close as my dad. Obviously, I was able to see that firsthand. But I think that it's a very common thing.
So, if affordable access to coverage existed, do you think that would be a good thing or a bad thing?
I don't see how that could be anything but a good thing.
All right. So, like I said, the budget project, Louisiana Budget Project, identified the entertainment and hospitality industries as the sector that would benefit the most from if the state took part in the Medicaid expansion. And so basically you and the people you work with could be winners into this thing, huh?
Yeah.
Yeah.
I very much agree with that. I think that the entertainment and the service industry, we don't have access to corporate health insurance, as good of corporate health insurance plans and things like that, and we need it. Everybody needs it.
All right. Great. Thanks.
Thank you.